Yes, here is your card and you can start now. Your time starts now. Come on.
Good afternoon.
Good afternoon, nurse.
Myself, Anitha Pachigolla, one of the registered nurses working at this medical clinic. Please be seated.
Thank you very much, nurse.
I would be extremely pleased if you can help me providing your basic information such as name, age, and purpose of your visit today.
Yes, actually, my name is Abraham Lincoln and I am 60 years old.
Could you please help me what has brought you here?
Yeah, I have come here regarding this something called insulin injections. The doctor asked me to meet you, so I want to know about this. What is the reason why this doctor? What's gone wrong? He asked me to take some change the medication plan.
Okay, well, I understand your fear about what is the reason that you wanted to know. Well, it is known that despite being very compliant with your medication, oral medication of diabetes, your results are not as expected. So the doctor has prescribed you to take injectable medications. So that is the reason why the doctor has advised you taking injectables. Do you have
Right.
any other concern?
So far, for the last 3 to 4 years, I have been managing well with the diabetes diet, medication regimen, and exercise program, and I was fit and fine as a fiddle. Everything is going on well. Then why this sudden change? What's the reason?
Well, I can understand about your concern about that. Uh, it is known that despite being you're very compliant with the dietary pattern, your medication regimen, and exercises, your sugar levels are not being maintained in a well controlled way. So, and when you're taking the oral medications of that diabetic medicines, the absorption is very slow and your sugars are not being controlled. Hence, the doctor has advised for a change of medication route so that by taking insulin injections, there will be faster absorption into the bloodstream and it is more effective in controlling your sugar levels because it's not going to break down in your stomach and there is faster absorption. So, is there any?
Yes, nurse. Actually, the thing is, many people are managing without these insulin injections with tablets and other things. So I feel embarrassed. Why is it necessary for me in the first place?
Because it's been very long time that doctor has put you on medications, oral medications, though your sugar levels are not being controlled. And also that there are people who are still who are on injectable medications, insulin injections, and still leading a very normal life by taking it regularly. And it is not a life-threatening thing, and it will not cause any such high-risky things. And you can even lead a normal life like any other individual.
That's really very fine. I really
Yeah.
appreciate your points. But the thing is, okay, fine. Yeah, if there is no other option, can you please tell me?
Yes, I am here to tell you the how you can take these insulin injections. So the insulin injections first, you have to wash your hands and make your hands dry and select a skin on your around your abdomen. Just to select the place and pinch the skin. And insertion of needle should be 45 to 90 degrees angle. And pinch the skin and insert the injection into your stomach. And you need to rotate the injection sites. You should not give injection at one site only daily because you need to keep rotating it to prevent formation of any lumps or slow absorption of insulin injection. And do you
Okay.
have any concerns?
Yeah, what if something goes wrong and I make a mistake, some bruising or infection or something else happens, and I'm not a professional nurse. So if anything goes wrong, what am I supposed to do?
Well, you can just put only ice pack application and do not do anything else. that will subside by itself. Just days, gradually it subsides, and there will not be any requirement of any medication or any local applications on that. So, and do you have any other concerns?
Yeah, that's fine. And what should I do with these used needles and syringes?
Well, I acknowledge that you have a quite positive thing how to dispose this used needles. Make sure that you need to select a suitable container to discard that used syringe and used needle. And proper care and handling is very important because there are you are very prone for getting needle stick injuries. So you have to make sure you will select a proper container. And also, I would like to tell you that the insulin vials are to be stored in refrigerator. It should not be exposed to sunlight or high temperatures. And before taking any insulin injection, you need to check when you're purchasing it from market. You have to make sure that you will be checking for the expiry dates, and also have to store it properly. So, is everything clear with you?
That's fine. And okay, fine. What after this container is filled? Then what am I supposed to do?
Yeah, you have to hand when once the container is full, you have to hand it over to the biomedical department. So, who comes the municipality corporate people who comes and collect the garbage. Otherwise, you can just hand it over at the clinic. They'll discard it in a proper way. So, if your concerns are clarified, will you be able to go for observation of self-injecting insulin?
Yeah, now that I understood everything, it is important. Yeah. Now I will give injection. You can please help me.
Okay, thank you.
Okay. So, and I want you to be with me for 3 or 4 days until I am confident with this self injection.
Oh yes, well, I'm glad I'll be here
Yeah. Thank you very much, nurse.
helping you with this.
Yeah. Okay. Now coming to the point, your feedback. Yes, you are doing very well. In between, there are some pauses and breaks, but you are confident. You have subject knowledge. Yes. And then, yeah. Sure, you have subject knowledge. That's very good. I can notice that one clearly, and you have that confidence level. You have to boost up still. You have to learn more vocabulary. You have to apply some, yeah. Commencement of insulin injections is what was recommended by the doctor based on certain conditions. You know, earlier you were able to manage very excellently, as you have told me. I really appreciate, but now the present conditions are not at par with the similar conditions that you faced earlier. Now your blood cholesterol levels increased, and your body cannot, generate that much, whatever. So you
Mhm.
can, so artificially you have to take insulin, and this is the best possible means because it will be absorbed directly. So you have to generate a special quality. You're speaking normally, but you should speak with excellence, and you can use simple complex compound sentences. Apart from that, you can, yeah, fluency you have to enhance, quality vocabulary you have to improve, then grammar you have to focus on what type of sentences, what type of connectors you can use. You can use two sentences, and you can, if I agree with your feelings and concerns, but remember, the doctor has taken this decision after considering all the possible options, and he has decided that this is the best possible one. So, like that, you have to create some quality there. And the next one is, yeah, pronunciation. Yes, you have to improve on a pronunciation a little bit. We are not native speakers, but we are Indian nationals, and we have a difference. But Indian accent is also accepted, but try to improve your pronunciation as far as possible, closer to the native speaking people community, near native pronunciation. At least that's what I tell you. So speak with some charm, speak with some quality, speak with some excellent accent to your level best. So that's fine. Do you have any questions?
No, sir.
Yeah,
I'll
whatever
focus.
doubts you have, or you have any concerns, or if you have any questions, you can speak now. You have 30 seconds. What do you feel about this session? Was this beneficial? How beneficial was it? Was this, did you feel that this was a real speaking session like that, or even more than that, or lesser than that, or a very ordinary quality of speaking session? What do you think about this particular session you had with me?
Yeah, I felt it as a really original session, like original cue card was given during my exams. And I had very less time. Those 3 minutes were really less for me to prepare. And then I became little panic and anxious about this. So my vocabulary and all this got stuck. And but really,
Yeah.
it's giving a training for to prepare for the original sessions, original or to
Yes,
attend
that's
the normal.
Yeah, that's very nice. Thank you for your feedback, and we will do your writing correction after some time. So now
Okay, sir.
yeah, writing sessions I'll separate now. So reading, speaking, I'm taking now. I'll finish off speaking fast, so that afterwards I can take writing.